Hello, everyone. Welcome to the podcast. Let's talk. I'm your host, Miriam, and today I have a very well qualified and well known medical doctor in the building with us today. And I would like to introduce him to all of you. So, please, sir, can you introduce yourself to us?
Okay, good morning, everybody. My name is Dr. David Iga. You know me.
Okay.
I'm the medical director, CEO of Diaby Hills Medical Center in Port Harcourt.
Okay. Can you tell us where your hospital is in case anyone wants to come
Okay,
around?
my hospital is at Somiari town. It's off Abloma Road,
Okay.
Port Harcourt.
Today's topic is a very interesting one. So parents, I would advise your children to permit them to watch it because it's a very educating topic today. So today we'll be talking about, should teenagers have access to birth control pills? And we have a doctor here already, so it's going to be very interesting. I need everyone to comment, pay attention, and enjoy yourself today. So at what age can someone be called a teenager?
Okay. Medically, especially in public health,
Okay.
It's somehow to define. However, a teenager is one that has attained the age of, say, 12 up to
17, 20.
below 20.
Okay.
Below 20.
Okay. Because I know back then in school, we were taught from the age of 13 to 18. Okay, even 22. I think
So
19,
just
that
say-
thing, that
Yes.
19, I think that's where they were told, we were taught that that's the age of a teenager from 13 to 19. So what are birth control pills? We've been hearing birth control pills, what are birth control
Okay,
pills?
birth control pills are a component of contraception.
Okay.
Now, there are pills that are taken for the purpose of preventing pregnancy.
Okay.
So it's just like a component of contraception. Contraception is whatever you do, whatever you take to prevent pregnancy.
Okay, they are contraceptive pills.
Yes.
Okay.
Yes.
You know, these contraceptive pills, I think is abuse. And I don't think teenagers should even have access to it. But anyway, as we go further, I'll give more explanation about that. So I was asking, at what age, okay, who should educate the teenagers about sex? This is the issue we have with parents at home. Most parents are shy of talking about sex to their children. They leave the work to teachers in school. And most teachers in school don't educate them about the sex very well. Is it health education? Then in my primary school, yes, primary or secondary school, biology was in secondary school. So it was in primary school they talked health education. Yes. So as a medical person, who do you think is more inclined to impart children on sex education?
Okay, the issue of sex education, I think, should be, not I think, it's a comprehensive thing. So you look at educating the parents, educating the children,
Okay.
and educating those who would educate both the children and the parents. So that's how it should be. So, of course, education starts from the home.
Yes.
But then how will the parents pass or educate a child when he's not educated? So that's why there is a comprehensive thing. So the parents are responsible for that. The school is responsible for that. The healthcare providers in this instance now they are also responsible for that training. So you see that it's a component of reproductive health. So I think it should be, it is not, I think, it is a comprehensive thing where parents are involved, the teachers are involved, healthcare providers at every point they come in contact with the patient. Okay. And the issues of health education is raised, especially as regards sexuality. They should be able to.
Okay, so as a medical personnel or as a medical inclined person, do you think or will you advise teenagers to have access to birth control pills?
Well, the issue of teenagers having access to birth control pills, there are some issues, there are some considerations.
Okay.
One, you look at ethical considerations, you look at cultural, and then you also look at the medical considerations. Now, as a medical practitioner, of course, the ethical part is there. You look at the the autonomy. Do they have the right to decide? That's on one hand. Then you look at the confidentiality as regards providing the contraception to them. Look at their privacy and all that. Then you look at consent. You must look at consent of the parents.
Okay.
And then you can now look at, okay, in looking at the consent of the parents, you look at their autonomy now and their privacy. So you consider all those things.
Okay. For those of us who are not medically inclined, when you talk about the autonomy, can you break it?
The autonomy is that these teenagers, are they empowered to make decision?
Okay.
As regards this issue of their sexual health.
Can a child of 12, 13, 14 even?
So those are the things, that's why you consider those things.
Okay.
Is this right? Is this child well informed? To take that decision. It still comes to informed consent. Have they been taught? Do they know what the contraception is? Do they know the risk that associated with making use of the contraceptive pills, and do they know how to use it?
Okay.
So medically, you must look at those things, and then of course, like I said, you marry it with their trying to give them privacy, and then their parents. Now you're involving their parents. Now you are now infringing on their confidentiality, their privacy to access those care, and then you also consider cultural issues. To religious, Nigeria now is majorly a Christian and Muslim country. There are some religious leaders that will tell you they are not in support of contraception, not even for teenagers. So you must know how you must consider those things. There are some communities too that take it that, okay, they pride in females who are virgins. Now you go into that community, you want to sell contraception use or use of contraceptive pills to the teenagers in that community. So it's like you're promoting indecency. You're promoting immorality to them. So all those things are things that you must consider. Then you also look at what are the medical things associated with it. Are they well educated to be able to use it? Do they know how to use it? Who are those people that would educate them? Who are those people that would train them? So there are a lot of things that you will consider before you now say, yes, you support teenagers. So you look at all these things, you look at there's an argument for and against. Okay. When you look at the things, the benefits, when you look at the benefit of it, you may want to consider. But then as a medical practitioner, you must put all those things together. In the domain where you want to, let's say you are in a community, and you are promoting it, you consider those cultural and religious issues. You also consider the individuals themselves. Are they up to the age? Are they well informed? Are their families, are their parents giving consent to read? All that, you consider it. So it's not just a one-way thing to say, oh, they should. We know that there are benefits to it.
In the case of rape, should birth control pills be introduced?
Okay. Like I said, in that case, you will look at parents are involved, the individual to at that point, Of course, those kind of cases, they come to the hospital, they are examined, and then the doctor or whoever, the healthcare provider, at that point has an avenue, to educate both the parents and the victim, the rape victims, on it. And then at that point, there will be education, and then there will be informed consent, and decision will be taken. So I think in order to prevent, one of the benefits is to prevent unwanted pregnancies. So in such instance, it's something that I would support that it's been given, because at that point it's an opportunity to have informed everybody. Giving them, after that information, they will give an informed consent to it.
Okay. What are the mechanisms behind the birth control pills?
Okay. For the pills, what they do is, one, they would prevent ovulation, which is the release of the eggs in the ovary into the womb through the tube. That's what that is developed. So the womb is made up of the cavity itself, where the fertilized egg is implanted, and then you have the tubes, right and left. Then the ovary produces the egg. When it's time for ovulation, the egg is released into the tubes, and at that point, there is the meeting of both the stem cells and the eggs. That's where it actually meets and it gets fertilized, and it's transported down to the cavity. So what it does is, one, it will alter the hormonal system of the individual, and then it prevents the release of egg. That's one aspect. Another aspect, it alters the cervix, is like the entrance into the birth cavity.
Okay.
That's the womb, the uterus. Now it alters there's a mucous membrane secretions. It alters them, make it more viscous. So it prevents the sperm cells from accessing the eggs. Now, in the event that fertilization has occurred, that means the sperm has managed to, egg has been released, sperm has managed to reach the eggs, and then there's a fertilization. It also alters that environment within we call it endometrial cavity, where the fertilized egg is implanted. It alters that environment and prevents it from implanting. So those are the mechanisms.
So that means it also interrupts the menstrual cycle.
Yes.
Okay. Are there types of birth control pills?
Yes, there are. For the pills, yes, they are the components. When you say pills now, I said the pills is part of is a component of the contraceptives.
Okay.
The pills, part of the methods is the pills. Now, the pills are usually hormonal pills. So there are different types. There are some that has both two components. There are some that are single components. You have estrogen, you have progesterone based. Then there are some that are combined together. Then there are some that are for emergency purpose. There are some that are intentional. Okay. Now, when a woman goes to receive family planning care, it's a component of family planning, So there is intentional that, okay, we are giving you these pills, you take it deliberately, say every day. You see the inscriptions are given. Those ones are something you take every day. Then there are the emergency pills. I usually call it morning after pills. Those ones are intercourse that is not planned for. For instance, the cases of rape, intercourse are not planned for. So those ones are called emergency pills or morning after pills.
Okay. I've had a situation whereby parents currently are taking their teenagers to healthcare to give them birth control pills, injections.
I was specific and I was deliberate when I talked about pills as a method.
Okay.
There are different methods.
Those ones they
are
inject,
injectables. They are not pills. Pills is what you swallow.
Okay.
So they are implants.
Okay. So
they are injectables.
So what do you think about that? Is it safe for a teenager from the age of 13 to 19 to be given either pills or be injected to prevent having children?
Okay. That takes us back to the initial question you asked, and I said there are ethical considerations, which part of it is parental consent. And parents that will give consent would have been educated. They would have been educated. Then now at that point, you now look at autonomy for that child. Is the child giving the consent to the parent, or they are being forced to? That's the area of I talked about autonomy. Are they giving the right to say, okay, we want to?
So most of these children, I'm not certain they even know what their parents are doing. Like, you can just say, okay, your mother can say, escort me to the hospital, and you're taken to the hospital as a teenager. Maybe the mom has seen that the child is wild, and now say, okay, let me take this child, so you don't bring shame to the family. You now take the child to the health center, and instead of telling the child, this is what I want to do, you just say, oh, they want to give you malaria drug, injection for malaria or typhoid, and before you know, they are being injected for such.
I want to believe that such practice will not be carried out by trained
medical
healthcare professionals.
Okay.
Those who are trained would know that the individual, the child, must have given consent, must understand.
So are you saying when they bring a teenager?
So at that point, even if the mother or the parents have conceived that, take the child to the hospital, the healthcare provider, if at all is being given, they would have educated the child.
So before the child is even given, they ask questions.
They must ask questions.
Okay. Are there benefits of these birth control pills?
Yes, there are benefits. Like I said, one is that it prevents pregnancies that are not wanted. Another benefit is that it will help reduce, or it helps to reduce the incidence of maternal mortality. Maternal mortality is the incidence and the prevalence of deaths death of women that are related to pregnancies.
Okay.
With reproductive issues.
So, everything that has an advantage definitely has a disadvantage. What are the side effects of this?
Okay, like every other medications, the contraceptive pills have their side effects. Common side effects like nausea, vomiting, and then, of course, you now look at things like excessive weight gain, for some.
Okay.
Then there is an alteration of their hormonal system, because that's what it does.
Okay.
Then there are also, on the extreme, there are risk of chronic diseases like non-communicable cardiovascular diseases. Like, when I mean cardiovascular now,
you have to
diseases that are related to the heart and the blood vessel.
Okay.
Hypertension, heart disease.
Okay.
Then cancers too.
Let me deviate from our question or topic for today. This practice of circumcisions for women, are you against it? Or?
I am totally against it. In fact, it was my undergraduate project.
Okay,
yes,
okay.
It's I discovered in the course of carrying out that research during my undergraduate days that these practices are still being done. Though when you look at then when I did it and now, it's quite some time now, over 15 years. But then those practices are still in existence. They are still there, and it's quite bad because you look at the long-term effects of it. There are complications, things like obstructed labor and all that, because there are different stages. There are different stages of the mutilation. It's currently called female genital mutilation or cutting. Now, complications that can arise can result to contracted pelvics and all that. So in the long run, most of them suffer complications during child delivery. Okay. And has it really defeated the purpose of doing it? Because what was the purpose there? Most of them would say that it's to reduce promiscuity and all that. Yes. Has it really reduced that? Well, I don't think so. I don't think so. Looking at the tribes, the areas of Nigeria, for instance, where those things are being carried out.
There's a question I've been meaning to ask, and thank God you're here today. So I don't know if I'm right, but let me just ask. I sense that this generation, the teenagers, they are more active. Most of them are very wild compared to like in the early 90s, from the age of, let's say, from 2000 to 2024. The teenagers, in terms of body, they look bigger than their age. What could be the result of that? They look more advanced than their age.
Okay, when you say much more advanced, is it in terms of their body mass?
Body mass.
Or what they do?
Body mass, what they do. Those two.
Okay. You know that there is now more of westernization.
Okay.
In these parts, because I know that this your question is in relation to what is happening within this our environment.
Yes.
Okay, there is more westernization. We are now consuming meals that before now were rarely even seen. So, most of the processed foods, of course, that we know that the percentage of the calorie value is high, the fat content and all that. So this has led to probably you now see people growing, and now people now pride in seeing their children big and chubby. They believe that when a child is big,
you're healthy.
In fact, currently people allocate affluence to their children being bigger in terms of being even obese. So I think we have adopted Western life, and of course there is more of urbanization, where parents are now very busy with work, so they will tend to use more processed foods for their children.
Okay, thank you very much. So thank you guys today for joining us. We talked on birth control pills. We talked about teenagers. We talked about how birth control pills they have benefits. They are also not too good. And before a teenager should be given birth control pills, the teenager needs to give his or her consent before taking any of the pills. And we had our doctor with us. He came to grace the occasion. He spoke very well about birth control pills. And his hospital is at...
It's off Abloma Road.
Off Abloma Road.
Female. There's a popular road, Female.
Okay.
There's a market there to opposite directly. There's a road directly opposite the market.
Okay.
That's where...
Okay, so he also talked about teenagers. Before you're called a teenager, should be from the age of 13 to 19. Okay, sorry. What's the difference between puberty and adolescence? Because most people don't really know the difference between puberty and adolescence.
Puberty is the age where a child, either a male or female child, starts developing those features of those sexual characteristics.
Okay.
So that's the age when a female child starts seeing her menses, what we call menarche, the point where she starts seeing her menses, the point where a male child starts developing those secondary...
Is it possible for a female child at the age of 12 to start seeing her menses?
Yes, it's possible. In fact, now the age of onset of puberty, which is menarche for women, is even getting reduced. You could even see 10, 11,
Has it always been like that, or?
Like I said, I think it has not always been like that.
Because I recall back then in my secondary school, most people didn't see their menses till at the age of 17, 18, 19.
Now you see.
So I'm hearing children are seeing menses from the age of 10, 11, 12. So it sounds strange.
Once they start developing secondary sexual characteristics,
okay,
like breasts for women, onset of menarche. Then for males, they start developing those sexual secondary characteristics like beards, developing beards, change of voice, and all that.
Okay.
They start at that point. They start recognizing their sexuality. They start, of course, this because of hormonal surges. They start having those desire for intercourse and all that. Their libido, and because of their now release of hormones.
That's at puberty.
At puberty.
Okay. What of adolescence?
Now, adolescence is just more of it's still using age. Age is not is still age related thing.
Okay.
It's not a medically related thing. It's not related to medicine per se. It's the puberty that is when you start developing those characteristics. That's when you now say, okay, you have attained puberty.
Okay, is there a disadvantage for a child who sees her menses, for a female child who sees her menses at the age of 10, 11, 12? Is there any disadvantage to that?
The only disadvantage that one may look at is that they are going to be exposed to the effect of estrogen, which there are certain conditions like breast cancer, uterine fibroid. They have said that some studies have said that a prolonged exposure, a long-term exposure to it is a risk factor for developing those conditions.
Okay.
So most time you find that most women are getting married early. So even if a girl child attains puberty at a younger age or a lesser age, she's most likely, because her secondary characteristics, sexual characteristics will start developing. So by the time she gets to 18, she's almost looking, like she's ready she's built, for marriage. And so if eventually she gets married at an early age and then childbirth starts and all that, so the likelihood of exposure to those things, estrogen and all that, will also be reduced.
All right, guys. Thank you so much, guys. Thank you for watching. I'd like you to comment, like, and follow us on all our social media handles. That's Peace Palace. Thank you.
I want to give a shout out to my colleagues,
okay,
the doctors who have been passionate about healthcare.
You're free to mention their names.
The doctors in Nigeria. In Nigeria. And then my kids, Sophia,
all right,
and Mackenzie. Okay. And of course my wife, BC, David.
Okay. All right, guys. Thank you so much. It's a wrap. So follow us on social media, Facebook, Instagram, YouTube. We love you all at Peace Palace. Comment, tap, like, share. We love you. Bye, guys.